Good morning. I'm Helen Fu, the host of this TV show, Health Factor with Helen Fu. I'm also a certified nutritionist, Chinese herbalist, and a specialist in diet, nutrition, weight loss, diabetes, and cancer. Have you ever heard of chiropractic treatment? Have you ever been to a chiropractor? Today, we have a special guest here on the show. He graduated from University of Massachusetts at Amherst and Life Chiropractic. He is one of the pioneers in chiropractic treatment in the New England area. Welcome to the show, Dr. Chapnick.
Thank you for having me. And pioneers makes me feel very old.
No, you are not old, but you are just experienced.
Experienced I'll go with, but thank you very much. It's been a lot of years already, and it's been extraordinary amount of fun for me.
All right, so Sandy.
Yes.
I want to call you Sandy instead of doctor. Okay.
Please.
And the first time I met you, I was really impressed because I feel like we talk the same language, even though we practice different modalities, and
Sure.
there is a lot of common knowledge and a lot of experiences that we have that are very kind of similar. I want to ask you, what kind of background did you have?
What kind of background? Well, as far as how did I get into chiropractic?
Yes.
It goes back to I was 14 years old, and I was wrestling with my next door neighbor, and he got me into a headlock and wrestled me to the ground. When I got up, but my head was kind of off like this, and I couldn't move it, and it really, really hurt. My mother had been seeing chiropractors since she was a child and said, "You're going to come to me with my chiropractor." And I said, I was a good 14-year-old boy. I did everything. I did everything my mommy told me to do. And she took me to a chiropractor, and he poked around a little bit, and he said, "Does it hurt right here?" I said, "Yeah, that's why I'm here." He laid me down on the table, and at 14, there's very little risk. And he adjusted me, and immediately after the adjustment, I got up. I could move my neck. It didn't hurt. And I thought, wow, this is really cool. Because at 14 years old, that's cool.
Oh,
I
wow.
went home and I looked up chiropractic in my 1964 Encyclopedia Britannica, because back then there was no Google. And as I was reading about chiropractic, my first thought was, this is healthcare of the future. This is the way that it's supposed to be. I went back for my next visit, and I said, okay, this is what I want to be. What do I have to do?
Really?
It
At
was
that age,
it
you
was
already
that
knew you wanted to do that.
it was an epiphany for me, because I knew I wanted to do something to help people, but I really didn't know what. My mother said, "Have you thought of becoming a podiatrist, or how about a veterinarian?" After my first adjustment, it was done for me, and I spent the rest of my childhood and then early adult life in striving to become a chiropractor.
What does it need? I mean, what's required to become a chiropractor? What kind of knowledge or schooling that you have to put into?
At this point, essentially you're really required to have a 4-year undergraduate degree, and not necessarily in the sciences, but there are a number of requirements that you need to fulfill. Chemistry, inorganic and organic, and biology and physics, and just another slew of other health-related fields. And you get your undergraduate degree, and then just like anything else, you'll apply to graduate school, chiropractic school. I think there's roughly around 16 or so in the United States. At least there used to be. I don't know what the current number is. And hopefully you get accepted and you continue on your path to helping others get better.
So tell us your first office. I understand you probably started really early in this area. And which year was that?
I started as an associate in the practice that my wife and I now own. My wife is my partner, Dr. Honeykiewicz. But I started out as an associate at Billerica Chiropractic Office in the spring of 1986. And the chiropractor who, and I have to say it because we are in Westford, the chiropractor who started that practice, if you want to talk about a pioneer, he really was. He was the 11th licensed chiropractor in the state of Massachusetts,
Wow.
Dr. Ken Weinbeck, who still has a practice here in Westford. But I started as his associate in 1986, and in 1990, after my wife had also joined the practice, we had decided that we would look to buy his practice, and we bought his practice as of January 1st, 1990. And it's been myself and my wife, and over the course of the years, we've had a number of associates come in and learn and help us see the numbers of patients that we've had. And it's really been an extraordinary run so far.
Well, it's interesting that you just mentioned, so your wife is a chiropractor also?
Yes, she is. She's the boss.
At home and at work?
Oh, absolutely, everywhere.
So how does it work for you? Sometimes it's kind of hard for husband and wife to be like together all the time?
We say we've been married in dog years. But it's really been wonderful because we each have our own strengths. I do a lot of the sports stuff. She does a lot of things that most people wouldn't think of going to a chiropractor for. She works with people with digestive issues, asthma, children with learning challenges. She's helped about a dozen women with fertility issues.
Oh, wow.
There's about a dozen little babies walking around this earth really because of my wife.
Oh, that's wonderful.
So we collaborate a lot, and what's also nice is having both a man and a woman in the same practice. It allows us to really open our doors to everybody, because there are some people who would prefer, gee, I really want a man doctor. No, I really prefer a woman doctor. So it really works really well in our office.
Well, that sounds great. I'm so glad that the relationship works well, both at
home
home and at work.
It really does.
Yeah, so tell me a little bit more about your practice and what's so unique about your practice, or why do people come to you?
Well, again, going back to the beginning, it was really one of the very first chiropractic offices really in the state. So for many, many years, if you were in the greater Billerica area, if you were going to a chiropractor, you were going to Billerica Chiropractic Office. And there are still slews of people that we see today that have been in our practice since I've been there, and actually even before. So we have that kind of a reputation. We're a family practice. We see patients from newborn babies to my oldest patient is this sweet little old lady. She's 98 years old. She's been my patient since I first got there. She was a patient long before I got there. And if you ask her what one of her secrets to longevity is, she'll tell you. I go to my chiropractor once a month.
Once a month?
Once a month. She comes in for a checkup.
That's amazing. 98-year-old.
98 years old, and I'm telling you, Helen, she is sharper than you and me put together.
Oh, wow. I would love to meet her.
She's quite the woman, and I told her at her 100th birthday party, I don't care whether I'm invited or not, I'm going.
Oh, absolutely. I would love to go and meet her also.
She's a great lady.
Well, what's the reason for newborn babies to be adjusted? Some people might feel shocked to hear this, and especially for people who have doubt about chiropractic treatment.
Whether it be newborn babies or children, the birth process, as of itself, even for an uncomplicated childbirth, is traumatic. It's probably the hardest day in their life. I mean, if you think about the birth process, 9 months. The baby's ready to come out. There's not a whole lot of room in there. Yeah. And you have children, right?
Yep, I have two.
So you probably remember that day when each of them were born. It starts off with a contraction.
Yep.
And usually the babies don't come shooting out right off the bat. It's usually many contractions over the course of many hours, which is putting tremendous stress on the baby. And first the baby's head comes through, and then they just don't shoot out like a torpedo.
Wish so.
I'm so glad I'm a guy. So now the baby's head comes out, but for the baby's shoulders to get out, the doctor has to kind of grab onto their head and line things up. And it's putting tremendous stress on these little tiny bones in their neck.
Oh.
And there are studies that show that little movements of the bones of the neck that we call subluxations actually can occur right at childbirth. So for those parents who really want the most natural form of healthcare for their child, and they want to make sure that they're entering the world as healthy as they possibly can, many of them will take their newborn baby off to a chiropractor who feels comfortable in taking care of children, and certainly we do. And for those people who have been to chiropractors, we don't do the same thing to a child that we do to an adult. It's mostly just really simple, just digital pressure, just a little bit of
with
pressure.
a finger.
Just with a little bit of a finger, we kind of feel around, just making sure that everything is lined up and moving right. And we find, that's just not quite right. That's about all it takes. The babies don't know they're getting adjusted. The parents don't know. But what they'll often find is for the fussy child, that as soon as we put our hands on them, everything changes.
Oh, wow.
It just takes them down a notch. Colic.
Oh, yeah.
Colic, for anyone who's had a colicky baby, there was actually a study that showed that chiropractic was 94% effective in reducing the symptoms of colic. And
That's
for
amazing.
and for any parent that's had a colicky baby, my word, you'll do anything to get them to stop crying.
Oh, yes.
And the adjustments are really very simple, and they work 94% of the time.
Wow. 94% of the time. That's totally worth a shot.
You think?
And so how soon can they bring the newborn baby to a chiropractor?
I've had patients, it certainly doesn't happen all the time like this, but I've had patients that on their way home from the hospital, their first stop is our office. But we've seen many babies within the first week, the first month, the first 6 months, and it just depends upon where the parents are and how they feel about chiropractic and its importance in the health of their family.
Well, that's great. And I'm just curious. Some people who have never done this, and I actually have some of my friends and clients telling me that I would never go to a chiropractor. Is it safe?
Safe. I'm glad you brought that up. Well, we can take this from many levels. You know what malpractice insurance is, right?
Yes.
Okay. So if you're a healthcare provider, no matter what kind of healthcare provider, you have to have malpractice insurance. And the way that the rates are set is based upon the potential risk to the patient. That's how rates are done. So if you're a brain surgeon or a cardiothoracic surgeon, the risks are tremendous. If you're an OBGYN, an obstetrician gynecologist, as a matter of fact, many OBGYNs have dropped the OB part because of malpractice rates. If you're an OBGYN and you deliver children, your rates can be over $100,000 per year.
Oh my goodness.
In malpractice. I pay about $1,500.
Oh wow. That's a big difference.
So
there.
if now the insurance companies run the show. They run the show, so it's based upon what they think they may have to pay out.
Yes.
So if they're only charging me $1,500, well then the risk has to be pretty minimal.
Yeah.
And if we look at it from just another standpoint, people are concerned about, chiropractors can cause a stroke, or it can kill someone, or it could do this. The risk of stroke, and this has been studied, is somewhere between one in every 3 to 5 million adjustments. Okay? I would have to live to be about 6,000 years old to get to that many adjustments. And if we look on the flip side to the potential risk in proper medical care, the current statistics are there are between 750 and 1 million deaths per year because of proper medical care and just because things go wrong. So that's 750,000 to 1 million versus really relatively none.
Yeah.
So the risks are just, it's a perception, it's fear of the unknown.
That's true. I agree.
And it's extraordinary to me that people have more faith in taking a little pill that they don't know what it is, can't pronounce it, don't know what's in it, don't know how it works, and have more faith in that than the body's inborn ability to heal itself, which is, as you know,
Yeah.
is what drives what we do.
Yeah.
If the body didn't know how to heal itself, nothing we would do would help.
Absolutely. I totally agree with that.
But because the body is designed to do that,
Yeah.
it makes what we do so effective, because the body is so willing to accept what we do because it's natural.
I totally agree.
It's
And,
working with the body's ability to heal itself.
That's my philosophy. Yeah. So what we do in Chinese medicine is really, we don't try to overpower the body.
Right.
We don't want to do that. We want to work with the body. So what we do is really, I think both of us, are more for prevention instead of trying to cure the symptoms.
Right.
So when we do it right, to work with the body naturally, the body has its own ability, amazing ability to heal itself.
There's an intelligence within it.
Oh, absolutely.
And that all you have to do is just break through the barriers of what's keeping it not well, or not in a state of homeostasis or balance, which I know you that speak in your language.
Yep.
It's really easy because the body strives to be well. I believe that we're genetically engineered to be healthy, not sick.
Yep.
And generally speaking, there are usually two reasons why someone is not healthy. Either they're not doing enough things for themselves that they should be doing to help themselves be healthy, or they're doing too many things that are truly unhealthy. So it's really two things.
Yeah.
Stop doing all the things that are making you sick and start doing some of the things that could help you get healthy. And then your body works the way that it should.
That's why I so totally believe in education. I think knowledge is really power. A lot of people, it's not, they don't want to do the right thing. They just don't know any better.
They don't know, or sometimes they want a quick fix.
Yep.
And look, I could be one of the laziest people on the earth. And I think that's also a little bit pervasive as well. People want someone else to make them well without taking responsibility for their own health.
Yeah.
And you know as well as I do that the person who takes responsibility has a much greater chance of getting well.
Oh, that's so true. Yeah, so as I said, actually, I have my own quote. I said, no doctors, medications, or surgeries can heal you, but you yourself. You are your own best doctor. So just know what's the right thing to do.
You're absolutely right.
Yeah, don't give the power to somebody else. And well, I think a lot of people still, they are not sure just because what kind of chiropractic treatment. And so sometimes, they are afraid that to hear that clicking sound or cracking or just sounds pretty traumatic. And what kind of practice that you do and what kind of methods do you practice?
Well, between my wife and I, there's probably about a half a dozen different techniques that we'll use to correct spinal misalignment that we call subluxation. And subluxation is just a vertebra that's either not positioned right or not moving right, ultimately causing some pressure on nerves, which will then decrease the body's ability to heal itself. So there are a number of different techniques. One of the techniques is we work with our hands, and you can hear these little clicking and cracking noises. And all that noise is pressure being released from the joint. It's really very simple. If you think of bubble wrap, you put pressure on the bubble wrap and the pressure kind of releases and you hear a little popping noise. Similar to the idea behind the noise you hear when you get an adjustment. Now, we'll use those types of adjustments for those patients who we think, A, will benefit the most, and B, it can be done safely. Okay? So that's one technique. There's another technique. There's a little handheld device that's called an activator. Are you familiar?
Yeah, oh yeah, I've tried it on myself and on my kids.
Okay, so the activator is a handheld little gadget, and it can develop up to 22 pounds per square inch of force. And when we use that on the patients, you don't hear the bones popping, you don't hear the joints snapping, you don't hear any of that stuff. And it's very specific, it's very gentle. So for the elderly patient who may be osteoporotic, or for the baby who obviously we're not going to go in with guns a-blazing, or or the patient who is just really fearful, or they just don't want to hear the noise, we can use that technique. Plus there are other techniques that we do like a modified decompression to help people with disc injuries and chronic arthritis in their low back. There's a table that kind of clicks up and drops down. Thompson technique. My wife does an amazing technique called total body modification.
What's that?
That works with ionized vials of water, and if there's a reaction, and she uses muscle testing. So she's getting into really the inner workings of the body, and she can do work people with allergies and things like that using that technique as well. So there's a number of different ways that we can go about taking care of the body, and we just match it up with the patient. All right, we've seen people like you before, and this is how we think that we can best take care of you. So we're going to start with that. But if we find it doesn't, we have something else in our bag of tricks.
So you can always adjust. It's not like a set.
Absolutely.
Yeah, you can try different methods and see which one responds better.
Well, it's almost like, even in the medical profession, I don't like using drugs as an example, but a doctor will say, well, we're going to try you on erythromycin first. And gee, you take the erythromycin, it doesn't seem to be doing the job. All right, well, I have another antibiotic. Let me try this one. So that
happens a lot. Yes.
We do that with techniques.
Yes.
We think we know what is going to work first, and if it does, great. If it doesn't, okay, we'll try something else.
Which one is better? Is there supposed to be like the best, or just that they're effective? Just depending on what?
There are some chiropractors who are very much married to a specific technique. And those chiropractors will say, this technique is the best for everybody.
I've heard that.
I don't believe that. I believe that everyone is different. And what way may work for Helen Fu may not work for John Doe. So that's why we like to offer a number of different things and match it up specifically to the patient. I don't believe any one technique is better than any other, because I have to tell you, there are many techniques out there, and pretty much all of them, they get results.
Okay.
They get results. So I don't like to be married to one technique.
Well, that's a great strategy there. So what kind of symptoms do people have before they come to see a chiropractor? What do you think chiropractic treatment will be effective for?
Well, the most common thing that people come to see chiropractors for is low back pain. It's the most common,
yes.
and I think the statistics are about 85% of all people will experience low back pain at some point in their lives. So that's probably the most common. And what will end up happening is they'll come to see us for low back pain, and then we take a case history and we find out, gee, they have some gastrointestinal issues, they have some other issues as well, and we'll say, look, we'll take care of you, and chances are your low back pain will probably do better. But I want you to pay attention, because you may find that some of these other problems that you have start to go away too, because once we work with the spine and affect the nerves, and the nerves go everywhere, then the chances are that may end up going away as well, just as the body turns to natural balance.
You use the word balance a lot, and that's my philosophy also. What I do is really try to balance the whole body. And also we talked a little bit about, when we talk about the health, it's not just the physical health.
Right.
It's important about the spiritual, emotional, mental, and physical health all together. So that's why I think it'd be great to incorporate some of the chiropractic treatment in what we do in prevention and natural healing. And so do you have any advice for people who have never done chiropractic treatment? Or
I think the advice would be is that if you try the same thing over and over again and expect different results, that's the definition of insanity. So for those people who have chronic problems with their low back, and they've continued to go to their medical doctor, and they've tried this drug, this painkiller, this anti-inflammatory drug, this muscle relaxant, doing the same thing over and over again, you're going to get the same results. In chiropractic, we look to find the cause of the problem, correct the cause, and then ultimately teach you how to take better care of yourself so that there's less of a chance of it reoccurring. If you haven't tried chiropractic yet, you're missing out on one of the, unfortunately, the best kept secrets in healthcare, I think. And the best thing to do is, you probably know someone who's going to a chiropractor, a friend, a relative. That's the way you really want to get your referrals. You want to find someone, oh yeah, I go to Dr. Weinbeck here in Westford, or I go to Dr. Chris Colic here in Westford, or I go to see Dr. Chapnick and Dr. Kawit in Billerica, and they're all great. So that's the best way to get the referrals. And if you're still not sure and you just don't know if it's going to be the right thing for you, then you call up and say, can I just meet the doctor?
They can just come and do a consultation without any treatment?
I know that's what we do, and I would pretty much guarantee you that most other chiropractors will do the same thing. Look, doc, I don't know if that you're the right person for me, but can I come in and meet you?
Okay.
And I think most chiropractors will say that and be just fine with it.
That would be great. And so where is your office and how do people find you?
Well, we're at 25 Bridge Street in Billerica, a little street that connects Trouble Cove Road and 3A Boston Road in Billerica, kind of around the corner from where Iverson Ford used to be. We've been there for 27 years. We have a website, billerica.chiro.com, that quite frankly gives an awful lot of information on not just chiropractic, but on a lot of things health. I have my own TV show in Billerica.
Right.
Have had it now for 15 years, and you can always catch episodes of You and Your Health. Billerica Access TV, go to Video on Demand and search for You and Your Health so you can find out more about what we do in our show. Or you could just always call the office and ask to speak to myself or my partner, Dr. Kawit. We're more than happy to get on the phone and give you any kind of advice you need.
Well, thank you so much for coming to the show, Dr. Chapnick. And I have a trouble to say your last name, but
it's okay.
I'll call you Sandy.
Sandy is fine.
Sandy. And I am also going to be on your show as a guest, and I'm looking forward to that. Yes. And so I'm just so glad we have the time to chat. And so today you've learned something about a new treatment, probably for some audience, chiropractic treatment. If you have never tried it, I encourage you to try it. And just stay healthy mentally, physically, spiritually, and physically. Until next time, bye-bye.